Good afternoon, Ozarks. Will and Carol. We're joined today by Scott Allen, the administrator from the Webster County Health Department. It's been 4 years since the world stopped moving for COVID. We're going to look back at that today, right after this. Well, thanks for coming back. We maybe may get some return viewers finally. Somebody watching the show. This is what, 6? You're keeping better track than I am.
It's the 6th week, and actually, I've been hearing from some friends that they are watching the show. You know, they're kind of picking it up, and they ask a lot of questions like, "How do I find it?" Which, of course, I'm the perfect person to ask technical questions too.
Sure.
So it's wonderful. We've got some good feedback.
Remind me when you leave today.
Okay.
I've got some cards you can hand out that have got like the Facebook and the Twitter and the YouTube handle on it. So
cost me $100, but I got a few people watching today, I think.
Oh, well, we appreciate your investment in the program. Thanks, Scott. Hey, I met you first on our other show, The Morning Waffle. You came on. You were our guest on there, and just wonderful to have you. It was a lot of fun.
It was great, and it's always good to be able to visit with folks.
And so when we started this show, we were talking about last fall, and we just wanted to have a show where a liberal and a conservative that like each other can have good conversations and talk about things and
Love it.
Not get screamy and stuff. So we're always looking at topics, and just this date kind of rolled around as, golly, here we are 4 years later.
And it's been a long 4 years.
It has been a long 4 years.
You know, it's interesting. I started, in August of 2019, I couldn't spell public health. September of 2019, I was offered this really cool cruise into retirement kickback job as the
How'd that work out for you?
Well, it's actually great.
Yeah.
I love coming to work every day. But was hired as a health educator and emergency planner, which is really my background. And then about mid-pandemic, the gal that hired me took off for Florida. And our board said, "Do you think you could manage a health department?" And I said, "I don't know." And they said, "Good." So we figured it out. And I'm here to tell you that the Webster County Health Department has done some amazing things during the pandemic. We learned a lot, grew very closely together as a team. And it's nothing we want to go through again. But I think, especially compared to a lot of other health departments in the state, we really came through it well.
Well, as a Webster County resident that was working at least part of my time in Greene County, in Springfield, I have to say I was thrilled with the way Webster County went through that very thoughtfully, without kind of overreacting, I would just say, and just said, well, let's just take a kind of a balanced approach. I thought it was really well done. So
I would love to take full credit for that. But I have to tell you that two things. One is I'm surrounded by brilliant people at work who make me look good. And the other thing is that I work for a very supportive board. And they're elected by Webster County residents. We're actually our own political subdivision of the state. So we're not a part of county government. We're our own governmental agency. And the people of Webster County elect our board just like they elect the county commissioners. And I work for a very supportive board who really gets the work that we do.
That's great.
Yeah. I'm abundantly blessed.
Well, I guess just to jump in a little bit.
Sure.
What I want to know, what was it like? I mean, I know what it was like for me, what it was like kind of in the general public, just trying to survive. But what was it like having to be not only just a private citizen dealing with your own life and the impact of it, but having to manage kind of the lives of other people too?
For me, interestingly enough, it was very much like when I ran for political office. many years ago, and was out knocking doors. And you knock on one door. Have either of you ever run for office?
I did, yeah.
There you go. So you knock on one door, and it's like you're the second coming, right? And they're so happy to see you. And come on in. Let me. Have you got a minute? Let me fix you an apple pie, right? I'll go out back and pick apples from the tree, and it's just a wonderful feeling. And then you go to the next door, and you're the Antichrist, right? And you're Satan himself standing in the doorway. And it was very much that way during navigating through the pandemic. I mean, there were some people who really appreciated the work that we did, and then there were other people who just didn't get it.
Yeah.
But they're all our people.
Yeah.
So we had to figure out a way to reach the masses, if you will.
So as, all of these orders are coming down from other places and cities and governments and states and all that, when those kind of approached you and you all had to make some decisions, what was that process like?
We made a lot of recommendations, but our board was on board with us that we never had any orders in Webster County that were county-wide. So some of the city governments did, and we supported them being able to do that. And I really liken kind of our approach to that. And I have to tell you that I'm the proud father of a rocket scientist and the proud grandfather of a soon-to-be rocket scientist, but I'm not one. So we took a very practical approach to it. And much like my experience in emergency medical services, we've got these big fires burning through the Texas Panhandle right now.
Okay.
And I presume neither of you got burned by them, right?
No.
And the reason you didn't get burned by them is because you were nowhere near them. And it really was the same thing with COVID. It's still spreading, and it still has the potentiality of spreading like wildfire. So the key is, if you're going to be exposed to other people, we recommend that you get up to date on your vaccines. If you get it, we want you to stay away from other people because we don't want you making other people sick. Just like if you go to a restaurant, we expect the food to serve good food that's not going to make you sick. So we really want people to just be good citizens.
Yeah, that's exactly the word that was in my mind. We just kind of want to be kind of smart and good citizens about it.
Yeah, absolutely.
I don't have anything to disagree with.
You don't want to.
Come on, Carol.
You don't have to disagree, Carol.
Have you guys got some boxing gloves at least we can put on? But no,
Carol would take my knee out so fast.
Watch it. Yeah.
Yeah, that's right. Well,
What was the most stressful thing for you as a leader?
Well, I think there were probably two stressful things. One was not having good knowledge ourselves of this thing. I mean, it was something that was new to all of us. And the other was it was like just as soon as we thought we had our brain wrapped around what was going on at the governmental level, things changed.
yeah.
And it's still doing that. I mean, the recommendation for quarantine for someone who actually tests positive for COVID just changed last week. And I get it. I mean, I understand that science is ever evolving and that as, we're getting a better understanding of it. But I got to tell you, it was tough when we'd tell someone, here's what we want you to do. And then the next day things change and we want them to either them to change or their neighbor changes. And then they talk and wonder why one person's still on quarantine when the other one isn't. It was a wild ride for us.
Well, and I think that you talk about science. I think one of the interesting things that came out of that, I mean, there's a lot of things that happened in 2020 that gave a lot of people a lot of distrust, across the board. But so many of the people from Fauci on down, when they talked about this stuff, said, we are science, this is the science, this is the way it is, instead of just saying, based on the best information we have today, this is what we think the best thing is for you to do.
Exactly. And that's really what we did. I will tell you, and the one thing that was tough, and I got involved early on doing case investigations and actually talking to people, talking to families. And the one thing that I realized is that COVID was a very predatory virus. So it would attack weaknesses in our bodies that a lot of people didn't know they had. So it would, and I mean, we lost. I think we're probably 200 or 300 Webster County lives that were lost due to COVID, and that's just too many people, you know. And certainly, I mean, none of us are getting off this earth alive, and I get that. But it was a really rough way to see folks who lose a loved one.
Sure.
And then not be able to grieve that loved one,
Oh,
and
yeah.
not be able to have a funeral, and not
Yeah.
and the horror stories and the things that we saw nightly on the news, you know, the bodies and, you know, semi trucks, and I mean something that the world had not experienced, we had not experienced, and not even anything close.
And
to
you know, when
that.
you look at all the freedoms that we have as Americans and all the liberties that we have as Americans, and then to say, hey, we want you to forget that you have all those and stay away from everybody, and don't celebrate birthdays, and don't send your kids to school, and don't. I mean, it's going to take a while to. I suspect that probably where we're at now is the new normal. I don't know that we're ever going to get back to 2018 normal.
But on the flip side, what if you hadn't? What if the government hadn't stepped in? What if every night the government said, hey, listen, this is some advice from the CDC. Do with it what you will.
I think we'd have had another Black Plague, personally. I mean, it would have been a lot worse.
I kind of have a different take on that, because I think that...
What?
I know. Because
okay, here we go.
Tell me more, Dr. Fauci.
no, I know, right? Yeah. No, I mean, I'm really interested. I mean, aside from the fact that it could go horribly wrong, I think it would have been really, really interesting, because what I saw around me and in my circle of people that range from pretty conservative to extremely conservative, and Carol, that's my circle.
I'm outside
So
the
you got the
circle.
She's outside
Carol.
Yeah, that's right.
Right.
That's right. You know, I'm talking March 13th through March 27th of 2020. COVID's here. I saw everybody I knew getting masks, putting on masks, willing to wear masks. And as soon as people started coming out, whoever they were, in towns saying, you must wear a mask, we are ordering you to wear a mask, that's when everybody's middle fingers went up.
Yeah.
And said no. And I think there's a level of non-compliance that comes in Americans, and particularly conservatives, when you tell them what they have to do. Whereas if you politely ask and encourage and suggest that maybe you're being a smart individual by doing this, I think you can get better compliance.
I love Carol's facial expressions, by the way.
Well, that's because as a liberal, Carol believes that the government is the answer to everything.
I do not believe that at all. I believe people are the answer to everything.
Reagan said,
it's out right up there on the sign.
It is.
government.
The most terrifying words in the English
Language.
yeah.
We're from the government.
Yeah,
We're here to
yeah.
help. Yeah.
Yeah.
But I just that's when I saw everybody say no. Is when people started telling us what to do. We don't really do that well around here.
Okay, but look, it's exactly like the helmet law. All of the data, all of the statistics, every single thing, every person would tell you that you need to wear a helmet because it's safe. Because if you have an accident on a motorcycle, you're more likely to get more seriously injured if you don't wear a helmet. And once that law changed, the day that law changed in the state of Missouri, how many people did you see riding without helmets?
Because they no longer were being told to, and because they had been told to, they were now exercising newfound freedom.
They didn't choose the safe option. Is my point.
Right, because the option to not wear a helmet had been denied for so long.
Right.
I think if you'd never passed that law, you might have been in a better shape.
You are crazy.
Sure, I will tell you.
But I do think it's an interesting perspective. And I think there's a slight difference, because when you're talking about not wearing a helmet, if I choose not to wear a motorcycle helmet, I'm endangering me and only me. When you were talking about the masks, back when we believed that masks work, and I think there's been data now that shows that maybe they really didn't do what we were being told they did. If I'm wrong, you can tell me.
So, well, I think that they helped people understand that it was important to practice safer socialization.
Okay, let's...
So I agree. I don't know that they were the save-all. And at the time I was responsible for the respiratory protection for our team, And we were involved in some national study. I mean, we got involved in a lot of stuff to make sure that our people had the best respiratory protection. And as we learned more and more and more, we realized that a cloth mask over a beard doesn't do a lot.
And I had a full beard
Yeah.
the whole time.
Yeah.
It was down to here. So it is what it is.
It is.
Hey, I need to apologize. We're not supposed to say things like "you're crazy," and I think I did say that to Will, and so,
Well,
so I apologize.
You didn't call me a mean name. That's okay.
A little bit of my wokeness, because in a previous life, I was a mental health first aid instructor. So crazy is a stigmatizing term.
Yes,
So that's that
yes.
conservative with a
Yes.
heart,
Yeah.
thought-provoking conservative coming out, right? So I get both sides of it.
I
Well-
just say I didn't take offense at it. I'll just put it
Well,
out.
you're not a snowflake.
That's true.
So,
Made-
so Scott, you don't know me, but so I have a tendency to use very colorful language in natural conversations, not here, but in my real
we're
life.
just waiting. for
And
it
so,
to slip
well,
out.
Perfect.
now, here's the thing. So, man, I made it through 4 sessions, so 4 shows. So, what happens is, like live, they don't
That was
have
interesting.
any
You start
caption.
talking about crazy and then sessions.
Yeah, I know, right?
Hey,
Yeah.
Carol, how's it make you feel?
shows. And so when you watch a rebroadcast, it is captioned. And so, and I did great for the first 4 shows. And the last show, I got my first asterisk of something that I said.
Oh, really?
I did.
My.
I got my first bleep.
I don't remember what that was.
ASS.
Yeah. Okay.
Ah.
Yeah. Yeah.
So anyway, go ahead, talk amongst yourselves. I'm sorry, I didn't mean to interrupt.
No, that's
I just
okay.
wanted to
It's
apologize.
Good topic, but
No, it's all good.
You were talking about masks and that they don't work, and
Well,
that's where
but
you left off.
So do they help? I think so.
if
Do
nothing
they-
more than just to keep it front of mind.
Yeah,
that you
I
need to
mean,
be
do they
cautious.
protect you 100%? No. I mean, same thing. Is a seatbelt going to save everybody's life, or is a helmet going to save everybody's life? I don't think so. As a paramedic for 41 years, I can tell you that I've taken seatbelts off of folks who passed away in a traffic accident, and helmets off of folks who passed away in a motorcycle accident. Not a lot, but it does happen. I think that much like a lot of other things that we do in life where we take precautions, I think that it really helps you make wiser decisions, right? So
And maybe it's more indicative of the personality. So maybe the person that wears the seatbelt, that wears the helmet, is more conscientious. So maybe a part of that is they're operating their motor vehicle.
They're better. They're just better people.
I'm
That's
not
what Carol's
saying they're
point.
better. I don't wear a seatbelt. I'm not saying they're better people.
I like to think that they make
So,
better decisions.
Yeah, there
I
you go.
think,
You know, they're
they-
more concerned about their personal safety.
And that's funny. I
and
am
perhaps the safety of others.
I am a seatbelt wearer.
Yeah, there
all
we
the
go.
time. All the time. Always do. Yeah. Ever since
You do it because it's the right thing to do, or because you have to?
I do it because it's a habit at this point.
Yeah.
Yeah. It just feels weird now to not have a seatbelt on when I'm
And
in
you
the car.
two are young enough to not remember there not being a seatbelt requirement. But when I started driving, there was no requirement for a lot of cars didn't have
Oh,
seatbelts.
I remember that. I remember being in the back seat with absolutely no seatbelts
Yeah,
and
when I was a-
fighting and yeah.
Yeah, when I was a kid, there wasn't a seatbelt.
Yeah.
Yeah.
And I was actually in a minor car accident, I remember, without a seatbelt on.
We're just well preserved, Scott. We just
Yeah.
look better than
Well, there you go.
younger than our ages.
We should let you guess how old we are.
No, we shouldn't.
No.
No, we should not.
Moving on.
Yeah. Well, I mean, I feel like we kind of covered that topic as far as maybe we need to.
Yeah,
but-
you know, and again, and actually, you know, it's interesting. We were talking about things changing. The quarantine recommendation changed again last week. So the latest greatest is that we want you to be fever free, or have a reduction of your symptoms for 24 hours, and then we'd like you to be masked or socially distanced for another 5 days.
Well, that's interesting because we just talked about masks, but that's still in the recommendation.
They help.
Okay.
Do they take care of everything? No. You know, and one of the things that was interesting is I'd see people with an N95 mask and wearing it over their ear or something. I mean, a good, well-fitted mask, properly used, is going to really provide a lot of protection
Without a beard.
without a beard.
You can't. Yeah, Scott and I can't wear because
So
my beard gets
during the
really-
pandemic, I did
could
not
shave.
have one. During our response to the pandemic, I did not have one. I mean,
not going.
technically, we're still in the pandemic. But we also had, they call them PAPR units, purified air powered respirator. So the hooded type units with the things that you wear on your belt that purifies the air. So we had 6 of those available for our team. So that way, if we had anybody that we couldn't fit with a mask, and fitting someone for a mask properly is quite the process. But if we couldn't fit them for a mask, we were able to get them into something that would provide that level of protection.
I'll tell you what drove me crazy, and is the.
There's that crazy word.
I know. It was yeah.
I know once I started right.
made me unhappy. It was the mask with your nose out.
Oh yeah.
It's like, why or what? What are
Yeah.
we doing here? Why are we bothering here?
Well, that and my wife and I just got back from a trip to southern Utah where we did a lot of hiking. So we flew out there, and it kind of took me back to flying during the pandemic, where it was okay, or you had to wear a mask, but it was okay to pull it down to drink. So, I mean, you're breaking that barrier.
Yeah. Well, yeah, and the fit is gone once
Yeah.
you do that too.
Yeah.
Yeah. No, we ended up flying internationally in 21, and so I mean, we had to have the vaccine, we had to have the test that was done within so many hours before
Yeah.
we boarded the plane, because we flew into Germany and then into Dubai. That was our ultimate destination, was Dubai, and then we had to have an app in Dubai that was telling us what the levels were, and then we flew back through, I think, Switzerland or something into Denver, and we had to have all these tests all the time, the whole time that we were doing it. But yeah, same thing on the plane. You have to wear your mask.
Yeah.
And one of the flights, there was one of the flight attendants that was just the mask Nazi. We'll just put it that way, because we were literally eating, and if you didn't bring your mask up between a bite, she was on you.
Wow.
Just,
Wow.
You have to, and I'm just like,
Wow.
seriously. I mean, like,
Wow. What difference is going to make? Hey,
Yeah.
Scott, what do you see? What change? Are you okay there?
Easy.
yeah, I'm
fella.
fine. I just-
Okay. All right.
little
Just hot coffee. No big deal.
No big deal.
Lukewarm coffee. What changes do you see that we've incorporated into our society and into recommendations from health departments pursuant to COVID? And has it affected other things like, cruise ships, like places, which quite frankly, I have always thought of a cruise ship as just a petri dish for germs.
I kind of
It is, and I'm a longtime cruiser, and
I love cruises.
yeah, and I mean, we used to go on a couple a year, and we haven't been on one since the start of the pandemic, and probably won't again.
Okay. And why is that?
Just so I think more than anything else, again, as an American, I have a certain level of rights that I enjoy as an American in America. Once you leave America, you're someone else's problem, and just hearing the horror stories about people trapped in a ship offshore, not able to get off for weeks, not something I'm interested in even taking a chance on.
yeah.
And that's that making wiser decisions. I have friends that cruise, and friends that are that go out of the country. Just not something that I'm interested in doing for my wife and I.
Well, my wife and I, we enjoy international travel, so it's something that we had to curtail a little bit, but we're getting back into it. We're
Yeah.
planning a trip. I've never been south of the equator, and so for our 30th wedding anniversary,
exciting.
we're looking really hard at Buenos Aires. And then-
Oh, I was thinking maybe Australia, but Buenos
Yeah.
Aires, South
Yeah,
America.
I just don't know.
yeah.
I will tell you that there is so much America
Speaking
to
of Nazis.
discover. Yeah, I mean, you be
Agreed.
again.
Agreed.
You be you, right?
You do
But I mean,
whatever dangerous stuff you want to do.
There's just so much America to see, and I still have those rights.
Yes.
And I can still, in most of the country, conceal carry, and I can protect my family, and I don't, it's goofy times, and I got to feel better about what I'm doing.
Yeah. Well, we are thinking about going to Maine for a trip, but you lose some rights when you go through that
Well,
part of the
that's what I
country.
was saying. And the difference is,
That's like a whole nother country right
Yeah,
there.
I know. We got to go through that a little bit. But yeah, I'm looking for a really good lobster roll. Not that we don't have a great one right here in Rogersville,
I
Divine
know,
Deli.
right.
But
so yeah. Let's
I want
talk
to go to
about all
compare.
the pictures you've
Sure.
been posting lately.
Sure.
Oh no, the health guy has been watching my diet here. Apparently,
Man,
Did you
Well,
see the one today?
Oh yeah, yeah.
Yeah, the Italian
He's like,
beef with
I'm
the
not-
sausage.
I'm not gonna eat the whole thing. Update, I ate the whole thing. Yeah.
That was great.
Wasn't that fun?
Yeah, that's it. I
Well,
enjoyed that.
Bill is really such a fun person. It sometimes
Oh,
surprises me you're
Carol,
conservative.
You're just. It's a real backhanded compliment, isn't it?
Yeah, yeah.
How can I like him so much and just like not like the way his brain thinks?
Yeah, well, it is the way it is.
Not agree with it. Right?
So, we've talked kind of about some of the weirdness that came out of that, but some really good things came out of
Very good
that
things
too.
came out of that.
Not the least of which is Planet 417. We're sitting here right here. This is a COVID invention.
There you
We
go.
wouldn't have this was spawned from being bored at home and during COVID,
Love it.
and so
And
it's
having
hard.
an amazing imagination and
well,
fierce
I
desire.
mentioned how well we came out of it as an agency, and again, I think that we have a very wise board. I have a very wise team that I work with, and I like to think that I've got at least half a brain. But during the pandemic, there were tax dollars that were available for COVID response, and a lot of people took those tax dollars and they used them for what I call hard projects. So hiring people, right, that sort of thing, and we basically spent all of our dollars on what I call soft projects. So we have the same size team that we did at the start of the pandemic, but we were able to expand the services that we provide. The other thing that we saw is that, traditionally, and the health department is 66 years old now, almost 67 years old, and 66 years ago, if you needed a vaccine in Webster County, you went to the health department. If you needed a nursing visit, you went to the health department. If you needed vaccines, you went to the health department. And we still do those things, and they're still very important to us. But what we realized is that our role, and this was really driven home, navigating through the pandemic, is population health, right? So what are the things, the systems that we can put in place to make Webster County a better place for everybody, and do it so sometimes you don't even know that we're doing it, right? So you went and you had your Italian beef and sausage sandwich today, and it didn't make you sick,
No, it did not.
right? You're welcome.
Made him full.
If you have friends who come and they stay in a Webster County hotel and they don't come out of it with lice, you're welcome.
Yeah.
If you dropped your kids off at daycare and they were well taken care of in a clean facility with good, safe water to drink, you're welcome.
Yeah.
So those are the things that we really are making, I think, a difference on, and that's been kind of a paradigm shift for us as an agency.
Well, that's really cool.
Yeah.
From the lawyer's side, I believe.
Well, now you're going to sue me for your sandwich?
No. But talking about good things that came out of the pandemic.
Sure.
In 2017, 2018, I wrote an order from one of my courts. It was actually out of Stratford. And I said, this is my virtual appearance order. This is how you'll do it. This is what you need to do. This is you register. You tell me you're coming virtual, and then we'll let you appear virtually in court. I got nothing. Nobody was interested in virtual appearances in courts. I didn't have any lawyers take advantage of it. They would rather drive to my court, wait in the courtroom back then, and all of that stuff. Oh, but all of a sudden, 2020, now we have virtual courts.
Yeah.
And,
You were brilliant.
So Will has always been on the cutting edge, and in fact, I was running late or something was happening, and I don't think he'd been a judge a super long time. And so I was like just despairing because I didn't have time to send a fax because whatever. And
Fax.
so I sent him hey, it was back in the day. Okay.
or the late 1900s.
Yes. And so I sent him a text, and he's like, this may be the first continuance request by text in the entire state of Missouri.
Yeah, or the country, maybe.
Love it.
Yeah, granted, right?
Yes, yes,
Granted
yes.
by text message. And now we do that kind of stuff all the time.
Oh, yeah.
Yeah. We have messages to clerks. When we file things, we can say, please reschedule this if at all possible, or we can make notations.
I went ahead and set up my virtual courtroom via Show Me Courts. So even defendants now, anybody, if you go to CaseNet, go to a case, and this is actually open to the public. You can click. There's a link. Go to court. Go to join the courtroom. And so I have my iPad on the bench now, and it'll show me these people are in my waiting room. and I have the clerk pull the file, and I bring them in, and I usually say, you need to turn on your camera and your microphone because I want to see them.
Right.
If they're like, well, my camera's not working, I usually will let it go. But
Right.
but yeah, we'll do all those things. The only thing we really can't do right now, and it's mostly, I think, because my city attorneys aren't quite there yet, is let them talk. So you want to talk to the city attorney, see if they can make a deal.
Right.
Now, when we were doing it live during COVID,
Mm-hmm.
I actually was using Zoom back then, which we can't use now. Missouri,
Right.
They said can't use Zoom, have to use
Mm-hmm.
WebEx. But I would send the prosecutor and the virtual appearing person to a separate Zoom room where they could talk. I couldn't hear them, and then I could bring them back into the courtroom. It was all virtual.
Right.
It was really slick. It worked out really cool. But that was, to me, that's one of the good things that came out of the pandemic is we finally drug lawyers kicking and screaming into the 2000s.
And judges.
It
Judges
doesn't. It
were-
isn't. But I think that from a behavioral health standpoint, I think that we've lost a lot when we lost that human interaction.
So tell us about telehealth. That seems to be a bigger thing now. Would you agree with that?
Oh yeah, I was going to say that's where
it
it
is.
is affected.
Yeah.
So we have a nurse-run clinic, so we don't have a provider on site, so we're not doing telehealth. I can tell you that there are a lot of rural areas who it was a real boon for them to be able to do telehealth. And from a provider standpoint, I think that it helps them get in and out sooner. We've come a long way though in health. I think that when you go to your doctor, you talk for a couple minutes and you have somebody in the room who's taking notes. You have a scribe in the room now, and I still am not used to having that.
This visiting about now with this fractured shoulder that I have, there's been a scribe in there every time, and that's been a new experience.
Oh,
for me.
yeah.
The dude just sits in there and takes notes the whole time, and the doctor will look over and say, lateral something this, and he writes it down. I don't know what he's talking about, but
and I mean, and as an old paramedic, I come from an age where the saying was, if you can't see it, you can't treat it. And anymore, I mean, you can go in with your shoulder and have X-rays and have labs and have everything else done, and never have to unbutton your shirt, and they can palpate it through your shirt. I don't know. It as an old guy, it's change is good. I don't know how good it is. So I think telehealth has been a real benefit, and that certainly that it's helped cut down on emergency room waiting times of 8 and 9 and 10 hours when you can see a doctor sooner. But I think that it's still got a ways to go.
Well, and when we talk about WebEx and meetings and Zoom and those kinds of things, I still like to see people in the room. I like to be in the room. I can tell I've attended meetings by Zoom before, and I'm very quiet, don't have a heart attack. And so it's just difficult to interject. It's difficult to converse. You don't know if you can't see all the people that are speaking. You don't know when they've stopped. And I just like the human interaction.
Sure.
I can't, if I'm on Zoom, I can't see the entire room. I can't see everything.
Right.
I can't see the eye rolls. I can't hear the...
you get a lot of that.
Yeah. So, a lot of language and a lot of conversation, a lot of communication is nonverbal communication. And I feel like we really miss a lot of that. On the flip side, there are a ton of advantages like you've talked about. And for attorneys, particularly where time is money, to be able to save waiting
hours.
Yeah.
Yes. And being able to do something while you're waiting.
Well, I actually hate Zoom meetings. I'm not a fan.
Okay.
We have multiple participants, but I like just fine. I would rather have a Zoom meeting with a client than a phone call with a client. Of course, I'm allergic to phone calls.
You
anyway.
really are.
But one of the reasons that I like the Zoom better than the phone call is because I can see them.
Right.
Because it's only one person I'm focused on. I can see their facial expressions. I can see their reaction. So to me, a Zoom is superior than a phone call, which is
I
the
think
worst
the biggest
possible.
thing for me is that it allows me to be able to attend 5 or 6 or 7 meetings in a day, as opposed to going to Jefferson City for one meeting in a day.
Yeah, makes sense.
Right, for sure.
Hey, we've got plenty of time left, but you've brought some things, and you had some things you wanted to talk about today too. So I want to make sure we get to all of that.
I do. Well, again, like I said, that we've been abundantly blessed. We've got an amazingly just a bright team of folks working with us. Actually, one of the things I wanted to share with you is that so a lot of folks don't know, but Missouri State has a master's in public health program, and we're very supportive of that program. And they have a lot of international students. So they asked us if we'd be willing to take on a student intern this semester, and we said sure. And they said, oh, well, that's great. Could you handle 2? And we now have 4 international masters in public health students. And we've got, and now here's one for you conservatively. So we've got these amazingly brilliant minds, right? 2 of them are physicians, one's a pharmacist, and one is just a brilliant young mind. They all have degrees from the countries they came from. We've got 3 from India, 1 from Nigeria, and having to jump through hoop after hoop after hoop after hoop after hoop with INS to keep them here. Where's this story going?
Yeah.
Right?
Sure.
But we've got folks coming across the border every day. Anyhow, so but we're blessed to have these folks working with us. We're currently, there are out of 115 health departments in the state of Missouri, there are 20 that are nationally accredited. So it really holds you to a high standard for delivering public health to your citizens.
Awesome.
So we've taken on that process now. So we're working on becoming an accredited health department, and it'll be a couple-year process. But I think that it's an important thing for us to take on. So we're really trying to right the ship, if you will, after 66, 67 years.
Do you think that your foreign interns, do they add a layer of knowledge or expertise? Do they add something that you appreciate?
Oh, they absolutely do. Yeah, they bring a wealth of knowledge from their countries and personal knowledge, and look at things through a different eye. I'm actually taking them to meet the commissioners tomorrow morning. So I think that'll be a really good experience.
Yeah, cool.
So
I was hoping for that answer. You know that, right?
Yeah, I know.
yeah. Yeah.
I didn't know what the answer was going to be, but I was like, please say what.
Thought diversity is a wonderful thing.
So and I do want to visit with you on this, and this is probably a different show, and this is something that hopefully that both sides of the aisle would embrace. So we were able to receive a grant from the Missouri Foundation for Health. Actually, we've received 2 significant grants that we brought into Webster County, and I'll do the first one is actually a federal grant that allows us to focus on marijuana misuse prevention and prescription drug misuse prevention. 10-year grant, or 5-year renewable for another 5. And we've got a full-time staff member working on that now.
That is incredible. That is so exciting.
Yeah, it's a medicine. Thank you very much. Because a bunch of people voted and said it's a medicine.
Yeah.
So
amended the Constitution.
Yes,
to be clear.
That's a whole nother
It is
story.
now part of the constitutional makeup of Missouri that marijuana is included.
So that's as far as I'll stick my neck out politically on that one. So the
We're all
other
over
grant
the
that we're
place.
working on, though, is from the Missouri Foundation for Health, and it's really an exciting thing to be working on. So we're one of very few counties in the state that received a similar grant, and we're looking at in a rural county, what are those things that in someone's life that from a behavioral health standpoint that if left untreated ultimately lead to law enforcement interaction, and how do we work upstream from there to try to put systems in place in a county? Because that's that population health thing, right? How do we make changes in our county to help address those things before they get to that point?
Interesting. That's
Yeah.
Yeah.
So it's a 2-year study program, and then we're hoping that coming out of that, we'll be able to find the best practice to implement in the county to ultimately reduce the amount of folks who wind up dealing with law enforcement, and instead of dealing with law enforcement, they're dealing with behavioral health specialists.
Yeah. Well, anything you can do to stop before we get the police involved,
Absolutely.
is a good thing. Doesn't mean we don't need police.
Oh, dear Lord.
I love police. We need police.
They have their role.
Yes.
We need police,
you take
for sure.
personal responsibility for your own safety and protection, and then then the police show up. Right.
There you go.
You mentioned in your emails, we were talking about you making the appearance, Narcan.
Oh, yeah.
Yeah. So let's.
So again, right, wrong, or indifferent. I don't judge people who have become addicted to a substance any more than I would ask them to judge me for being a heavy-set old man. And I cleaned that up. So, the kicker is, though...
It's going in circles in my head.
filter.
Yeah, I know.
So the kicker is, though, that one thing the truth that we hold self-evident is that dead people never recover. Right? So I'm a big proponent of Narcan. It's the safest drug that I've ever given as a paramedic. I've given gallons of it as a paramedic, and it's safer to give someone than oxygen is. It's that safe of a drug. So I
was just going to say, maybe we should explain what Narcan is first.
Yeah,
I mean,
Narcan is a narcotic antagonist. It binds to the receptors in someone's body when they've got a narcotic on board, and it blocks the effect of the narcotic. So it can reverse an overdose by doing that. So I've been an instructor for years on how to give Narcan. It's a pretty in-depth course, takes about 15 minutes, and that's the extended version.
well, we're passing out in vending machines. I understand.
Absolutely.
So, yeah.
So super easy to show someone how to do. I mentioned that at a kind of a state of the county's health presentation I did for the Rogersville Chamber, and said that we're available to come out and do that. So Bill's Quick Mart,
Yes.
here in Rogersville, actually called us up and said, you know what, we'd like to take you up on your offer. So I went out there and in their back room, visited with their team and talked to them about how the drug works and how to give it, and left everybody with some Narcan. And about a month ago, they called me up and said, hey, we need some more Narcan. I said, oh, did yours expire? She said, no. We used it and we saved a life with it.
Yeah.
How exciting is that?
Yeah.
That's very
Linda called me up
exciting.
and she said that someone came in and said, I think that my girlfriend is overdosing, and they wound up having to give 3 doses, and it reversed an overdose. And I was able to confirm that with the first responders. I said, hey, did this really go down this way? And said, yeah, she was breathing by the time we got there.
Scott, I'm actually getting chills. What an amazing story.
So it again, and the other thing is that I think that it's important, so we all have this kind of picture in our head of someone who's an addict that maybe is laying in a back alley with a needle stuck in their arm. But the truth of the matter is that addict quite probably was a 14-year-old high school student at one point in time that had a really bad shoulder injury, got some pain medication for it, became addicted, wound up getting taken off of the pain medication, and was just trying to get through every day.
Yep.
So every one of those folks has a story, and again, do I think that it's more important to give Narcan to folks than it is to give medicine to the elderly? Not necessarily.
Right.
But it's something that can certainly very easily save a life.
Yeah.
So, Scott, not for today, but what might be an interesting topic, Will, in the future is in Canada, and I think other countries as well, they have...
Dear Lord.
I know, that beautiful country to the north.
I hear my mom calling me.
Continue.
So they started clinics and places where drug users could use illegal substances, and so, as a liberal, I kind of listened to this police officer that said, I was absolutely 100% against it. I thought it was ridiculous, and I have seen what it has done, and it is effective, and it is kind of a conduit to some people getting drug-free and to going to rehab and things like that. And so maybe we could have a show sometime in the future about that. I think that would be kind of a fun topic.
Yeah.
Interesting topic.
You can bring your first guest on, and you can.
I'm going to bring some guests. I'm just kind of. I'm kind of getting warmed up. I don't want them to be. I know that you wouldn't attack them, but I don't know if you would go gentle into that night. So.
And I've wrestled with that.
Killing you softly. Is that
as a father of two sons who
Oh
are
my
productive
gosh.
members of society that
Rocket
are both
scientists.
in long-term recovery, I get it.
Yeah.
You know, and for a long time, the only time I knew they were safe was when they were in jail. So, but I also don't know that as a society, that Webster County, Missouri is ready for a safe use house right now.
No.
Would I rather see people using out on the street? I'd rather see people not using.
Right.
You know, and again, that's that working uphill or upstream, if you will.
Right. Absolutely.
That we're hoping this grant's going to provide for us, and that's one guest that I'd love to have come visit with you. So
Yeah.
hopefully we can set that up.
Yeah, that would be great. Scott,
Yeah.
it's been great having you.
Absolutely.
And,
Thank you so
I
much.
fully expect you to be on the show many times in the future.
Yes.
I would absolutely welcome that opportunity.
Yeah, no, well, it's probably, you've got my email. I'll make sure you got my phone. If you ever have
We won't answer it.
I won't answer, but
You'll
you can
have to
text.
text.
You can text me.
Well, I left a
Text
message
only
today when I was
subscriber.
running late and had to go into Springfield to make a U-turn for crying out loud.
But
Contacting Will is like my clients that are out of minutes on their phone or text subscriber only. So
there's easy ways to get a hold of me. You just got to know what they are.
Yeah.
You gotta take advantage of them. But no, if you ever are like, hey, I got something I want to talk about, just let us know.
Super.
And we'll get you on here.
yeah, we want to
do
hear
it.
about the grant results too and things like
Yeah,
that,
for sure.
and how those programs are
Yeah.
happening.
Yeah.
Are going.
Cool. Good stuff. Well, hey, everybody that you watched, both of you, thanks for watching the show.
Have a great week. Hey, I'm headed to a city council meeting. So I want to have a show sometime soon about the Lake Springfield plan. So
Yes.
soon is pretty soon because it's going to be presented to the city council at a luncheon supposedly this
And
month,
we
but
may
I can't
do
get a date.
may do a remote show on Earth
Oh
Day
yeah,
from Lake
I'm
Springfield.
so excited about that.
Yeah, how about
I'm
that?
so super excited.
We'll have to see if we can talk our producer/director into making that happen for us. But that'd be fun. But
Yeah.
Hey, everybody, thanks for watching, and we'll see you next week.
Have a great week, everybody.